What sorts of tests and lab work might you use for your patients?
Um, so what makes optimization and functional medicine very unique is that there's not a cookie cutter labs or tests that everyone might get or may not get. When you head towards traditional medicine, everyone gets like a CBC, a BMP, vitamin D, thyroid panel. There's always a set protocol of labs that people get, usually because that's what insurance will cover, variously looking at various chronic illnesses. We do those because those are important. Thyroid looks at your metabolism and your overall health. Hemoglobin A1Cs looked at your risk of diabetes versus pre-diabetes and how your inflammation is doing in your body, as well as your sugar control. So we do those labs, but we do dive deeper. So we really get into listening to people and listening to their history. So we look at the nutrition that they're eating. Maybe they're getting a lot and eating a lot of processed foods and fast foods, which are at high levels of xenoestrogens, phytoestrogens, these synthetic hormones that can really mess up someone's body. Someone might be living by industrial plants and be exposed more to heavy metals or things of that nature. So we kind of look at everyone as a whole and listen to their backstory. We focus on what exactly that person, has or wants to overcome, and go from there. Other labs that I should say the convenience of labs that we do is we still can get serum or blood draws that people typically know from going into like LabCourse or Quest. But then we also go into at-home type of testing as well, because some of these tests can be overwhelming for people, and the convenience of being at home is a little bit better. Plus, some of these labs, which I really like, the Dutch test, which is dried urine test, that looks specifically at hormones, hormone metabolites, ovarian cancers that, or the possibility of getting certain cancers, neurotransmitters. I mean, we get into a lot of things, vitamins, minerals, things of that nature. That kind of gives a whole picture of how that person is functioning throughout a day-to-day basis. We can pinpoint and figure out why people can't sleep or sleeping all the time, why they feel a certain way. Like a gentleman, for instance, may feel not as masculine or manly as he once was, tending to have more fat on him, and depression. We can pinpoint that all with the Dutch test, and that includes just a saliva and or urine test at home. It's very straightforward. We also have a lab that I like to use called ZRT, and they have, again, saliva as well type of testing, urine as well, just like the Dutch test. But they also can do like a finger poke to get a little bit more blood. We kind of correlate those depending on the therapies and symptoms that people have, and kind of go from there. Also too, which is very amazing, in my opinion, is we have this test called the GI map or GI mapping, and ultimately what it is that an at-home test that a person can find out by giving us a stool sample, can find out their gut dysbiosis or what bacteria and viruses is living in their GI system, their gastrointestinal system, which could be causing constipation, diarrhea, upset stomach, leaky gut, things of that nature, which could be contributing to other illnesses and issues as well. So as you can see, we got a plethora of options for people, both at home, in clinic, serum, blood, urine, saliva, everything. It's pretty exciting, and it gives the overall convenience of every person a chance to get the tests and labs that they need and want at their convenience and their comfortability level.